Hi, I'm Dr. Bojack from Atlantic Chiropractic in Stoneham, Mass, your posture doctor. Okay, today we're going to talk about the principles of soft tissue, injury, and repair review. Okay, so soft tissue or scar tissue is our nemesis or our challenge in regards to getting you, the patient, and our members healthy. Okay, so there's two forms of scar tissues. There's the original scar tissue when it actually is irritated, right? And it's basically just squiggly lines, okay? And that's because there's no motion or there's less mechanics of movement and motion in the joint, and that causes that squiggly line, okay? And those squiggly lines are similar to cement or glue, okay? So this cement or glue, because of the way this scar tissue is healed, makes that joint irritable. So you have less range of motion, okay? It's less elastic, it's more sensitive, it's more aggravated when you're stressing that joint out, okay, or trying to put it under a full range of motion. You get much more chronic pain and disability as a result, and there's an alteration in the functional capacity of this scar tissue as a result also, okay? So when you come in, our first 8 to 10 visits of our adjustments, we're literally micro tearing this scar tissue and reestablishing the full range of motion and movement in your joints. After we've established full range of motion, then we literally can start downloading your new postural patterns, your new functional patterns that are going to work for you versus against you. Okay, so we're gonna put that head back. We're gonna bring those shoulders back. We're gonna take that translation out of your head or a high left shoulder and bring that down, or even a rotation in your thoracic cage. Okay, so we can start changing your postural mechanics in your spine once we open up that scar tissue, which is like cement or like glue as a result, okay? And once we start doing that, then the scar tissue will start healing and normal, good, functional adaptation, okay? And it's gonna be a controlled motion during this regeneration, okay? So you're gonna have, when you have this, right, we have a lot less active motion, a lot less passive motion, okay? And as a consequence, you got to force yourself to go into more ranges of motion. Versus here, that's when we start having the full ranges of motion. You don't have the sensation, the vascularity is better, you start feeling healthy as a consequence to that. So again, this scar tissue is really important in regards to a component of your healing that takes place as we start your program at Atlantic Chiropractic, okay? And that's one of the biggest reasons why you're using the ice, right? We don't have WD-40 to squirt into the spinal joints, so the ice is what we utilize. That's going to decrease the swelling, decrease spasm, decrease any irritation in there as a result. So it kind of sets up that joint and that scar tissue so we can work with it versus work against it, and start to create the motion and the normal mechanics of your spine to, again, establish good postural patterns versus negative postural patterns, right? I look forward to seeing you at Atlantic Chiropractic so we can look at your posture and to determine and diagnose exactly what your problems are as a consequence to that. Talk to you soon. Our phone is 781-GET-WELL, 781-438-9355. Look forward to meeting you. Have a great night. Bye-bye.